Días, bom dia, good morning. Bienvenidos a nuestro seminario virtual
to this virtual seminar celebrating the decade of healthy aging in the Americas that we're celebrating today with the International Day of Older Persons. And congratulations to all the older persons for celebrating today. My name is Patricia Morsch, Technical Officer from the Pan American Health Organization, PAHO. And today it is a pleasure for me to be the moderator of this event that has as its main objective to introduce a decade of healthy aging as an opportunity in the region of the Americas, so that together we can bring leaders, organizations, and the different interested parties in order to improve the life of older persons and their families and their communities. Therefore, in this event, we will introduce the decade and the perspective of its development in an interagency fashion. During this 1-hour event, we will have a presentation by the representatives of PAHO, the Economic Commission for Latin America and the Caribbean, ECLAC, the Organization of American States, the United Nations Fund for Population Activities, and the International Labor Organization to introduce their points of view in connection with the decade of healthy aging. Thank you very much for your participation in our event. Thank you. Before I give the floor for the welcoming remarks to Dr. Jarbas Barbosa, Assistant Director of PAHO, let me take advantage to share with you some tips and guidelines to be taken into account during our seminar. The event will be broadcast in 3 languages, English, Portuguese, and Spanish. I ask you to make sure that you're connected to your language of choice. In order to access your preferred language, you can click on the interpretation button at the bottom of the screen. It is a globe icon, and you can select the same language so that you can follow the presentations.
Screen at the icon globe. Tradução ao português está disponível na barra inferior da sua tela do Zoom, no ícone em forma de globo. Esta sessão será gravada e posteriormente compartida em la página de envelhecimento.
The session will be recorded and later on shared in the Healthy Aging Department and in PAHO's website in the 3 languages. Take into account that this is an information session and we will not have a specific Q&A session, but you can use the chat function in order to begin conversations and ask questions in the Q&A session that will be responded during the session. And with this, I close the introduction. And to close the event, the introduction, I'd like to invite Dr. Barbosa to extend to you the words of welcome. Dr. Barbosa, please go ahead.
Thank you, Patricia. Good morning, everyone.
And very special greetings to all the older persons in the Americas. Congratulations on behalf of the Pan American Health Organization, PAHO, and our director, Dr. Carissa Etienne. Today, October 1st, we're commemorating the International Day of Older Persons, and we also kick off officially the United Nations Decade of Healthy Aging. During the last decades in the region of the Americas, we've seen an expansion in the opportunity to live better. Currently, in spite of the major differences and the great inequities that still exist, more than 80% of those that are born will live beyond the age of 60, and more than 40% will live after the age of 80. Population aging is one of the fastest in the world. Towards the end of this decade, the Americas will have more people older than 70 years than children under the age of 15, almost 30 years before the rest of the world. Latin America and the Caribbean will have almost 100 million of older persons. Our countries have improved their health and their healthy life expectancy, even though that improvement has not followed the same pace as the increase in life expectancy. That difference has increased the gap between life expectancy and healthy life expectancy that today is of almost 11 years in the Americas. Closing this gap is a significant challenge for the region. It is necessary to make sure that our older adults not only will live longer, but that they do so with health and well-being as much as possible. The United Nations agencies, as well as the Inter-American system, has seen how this has triggered this rapid population transition, which has also come hand in hand with a rapid epidemiological transition, as well as transitions at a social, technological, and cultural levels. Aging of our populations is taking place irrespective of the socioeconomic level, and when our countries still face matters that are still awaiting solution in their social and health agendas. The region of the Americas has carried out very active work in the area of aging in the last 2 decades. It's been the first region in having a plan of action on aging and health, and it has also been the first and only one so far in approving a convention to protect the human rights of older persons. But this is not sufficient. We need a greater effort and concrete actions so that aging and living longer will not constitute a problem, but an opportunity instead for persons and for societies. We know that the COVID-19 pandemic has affected and impacted in a disproportionate way older persons. Mortality and direct and indirect complications of conditions and diseases have been greater in the older population and took place in all socioeconomic contexts and in all levels of social and health development. Undoubtedly, the pandemic has laid bare the fragility of health systems and social protection, as well as health services organizations, social services, and society at large, in order to take care of the needs of this group. Today, this decade of healthy aging provides us with an opportunity in order to change the future of our older adults. The decade is a multi-sectoral effort, an inclusive effort, in order to build a society for all ages through cooperation amongst different stakeholders, having the older persons at the center and at the core of the plan. It is a continuity of the International Madrid Plan of Action on Aging and responds to the 2030 Agenda for Sustainable Development. It is an opportunity to bring about a transforming change through intersectoral initiatives and many partnerships that will respond to the needs of older populations currently and in the future, particularly in the national and subnational context. Dear colleagues, this panel reflects the integrating will of the decade. The decade acknowledges the need to involve everyone, governments, civil society, academia, the private sector, and particularly to have the active participation of the older persons themselves, their families, and their communities. The United Nations has called on integration of all agencies, funds, and programs within the system to work in an integrated fashion at a global and regional levels, but most especially at a national level, and provide support to member states in that search for healthy aging for all. In the Americas, the Inter-American system excitedly joins that objective. As I pointed out previously, on October 1st, we celebrate the International Day of Older Persons. This year, we're dedicating this to the topic equity, digital equity for all ages. That is the theme for this year. Increasing significant participation and access into the digital world by older persons. Technological progress offer a great opportunity in order to expedite the progress towards sustainable development goals. But in order to do that, we should reduce the digital gap that currently impacts the older persons. We have to say that Latin America and the Caribbean, close to 30% of the people in our region do not have access to the internet. So we should take a look at policies in each country that could expand that access, and that is extremely important for health as well as for the well-being of all people, and in particular for the older adults. PAHO is committed to the activities of the decade, and in that search for health and well-being of the older persons, their families and communities. And we welcome the multi-agency work in order to achieve sound and broad efforts in the region of the Americas. We're very grateful for the regional commitment of the United Nations agencies and the Inter-American system by addressing special recognition to those who are with us today and to present their perspectives in this virtual event. So once again, on behalf of PAHO, I'd like to thank you all for your participation in this event, wishing the best of success to the decade of healthy aging. Thank you very much. Patricia, back to you. Thank you very much, Dr. Barbosa. I'd like to stress the words of Dr. Barbosa on the importance of cooperation amongst the different actors with active participation of the older population in order to attain the SDGs and the decade objectives. I'd like to welcome the decade of healthy aging through the presentation of a video.
They say there is a right age for everything. We believe that the right age is now, no matter how old you are, because you should have good health, have dignity, be able to participate, have the chance to grow and develop, deserve to be happy. We believe that every year can be lived to the fullest, because every year matters. Life has no age. We welcome the decade of healthy aging in the Americas. Join us and support healthy aging.
Bueno, a continuación les presento al panel de representantes de las agencias de las Naciones Unidas y del Sistema Interamericano que presentarán sobre sus perspectivas en torno a la década del envejecimiento saludable. Harán parte del panel el doctor Enrique Vega, jefe de la Unidad de Curso de Vida Saludable del Departamento de Familia, Promoción de la Salud y Curso de Vida de la Organización Panamericana de la Salud, el señor Simón Cecchini, director designado de la División de Población, CELADE, de la Comisión Económica para América Latina y el Caribe, la señora Mari Carmen Plata, secretaria de Acceso a Derechos y Equidad de la Organización de los Estados Americanos, la señora Florbela Fernández, directora regional adjunta del Fondo de Población de las Naciones Unidas, y el señor Vinicius Carvalho Pinheiro, subdirector general de la OIT y director regional para América Latina y el Caribe de la Organización Internacional del Trabajo. Doctor Vega, por favor, puede empezar su presentación.
Muy buenos días, muchas gracias Patricia, muchas felicidades a nuestras personas mayores en este día 1 de octubre, que no solo marca la celebración de cada año del Día Internacional de las Personas Mayores, sino también el comienzo de la década del envejecimiento saludable. Ir hacia la década del envejecimiento saludable es un reto que se ha construido durante muchos años. La región de las Américas, como ya se dijo, tiene una historia extremadamente importante en el desarrollo de este proceso. Ha sido líder de muchas de las acciones que en política internacional se han tomado a nivel regional y a nivel global. Y creo que la década vuelve a abrir una oportunidad para ese proceso. Yo creo que el Reporte Mundial del Envejecimiento y la Salud colocó de manera importante un nuevo concepto de envejecimiento saludable, reconociendo que este es aquel proceso que permite fomentar y mantener la habilidad funcional que brinda el bienestar en la vejez. Pero lo más importante quizás del concepto es haber
Doctor,
definido.
disculpe,
Sí.
el intérprete necesita cambiar de lenguaje. Gracias. Puede proseguir, por favor.
Thank you, Fernando.
Lo más importante de ese
So the
concepto
most important in that concept is to define the functional skill where we do not restrict that functional skill, limiting it that to the daily skills of our daily life, but we speak of the attributes that are linked to health and that allow a person to do and to have the reasons to appraise that. And that is essential because when we speak of functional needs, many a times historically, we had not confined that to those basic needs. Today, what we intend is for the older persons, our older population, to be capable of continue learning, growing, taking actions, building and maintaining relations, and moving on. And in order to have that capacity, that functional skill present, we've defined the main components to maintain the intrinsic ability, the skills, the sum of all physical and mental skills of people that accumulate people throughout their life, and to have a favorable environment in order to be able to develop that ability. So the concept gives us a conceptual framework, a theoretical framework in order to be able to work in this decade that becomes in 10 years of concerted cooperation that was approved in August last year during the World Health Assembly at the UN, and which was endorsed and validated by the United Nations General Assembly in December 2020. So these are 10 years of cooperation. Catalyst ratified in order to look to bring together not only governments and international organizations, but also to participate with the professionals, with academic institutions, with the mass media and the private sector in a basic function guided by older people, by their families, their communities, in order to achieve a significant change in the life and the quality of life of these people. They have essential basis foundations that have already been mentioned: the Plan of Action of Madrid, the Human Rights Convention for the Older Persons, the Plan of Action on Aging and Health, and many others. And other conceptual technical documents, internationals, that in the different context with the different international agendas at a multi-sectoral level have been developed in international policies. An essential purpose in the development of this decade is to make sure that older persons and aging will have a vision, a basic vision within the Sustainable Development Goals. We have to place aging, the older persons, and aging in general as a part of all the Sustainable Development Goals. The principles of the decade are clear, from the interconnection, indivisibility, the inclusive nature, alliances and partnerships with multiple parties, universality, solidarity, intergenerational solidarity, commitment, and not leaving anyone behind, and obviously not cause any damage. These are part of these basic criteria. And we have 4 areas of performance that have been clearly defined, and they are important in order to define the objectives for the decade, to change our way of thinking and feeling and acting regarding age and aging, to wage a head-on battle against the discrimination because of age, and to be able to make sure that the older persons will be capable of exercising their rights all across the board, to make sure that the communities will promote the capacities and the skills of older persons, allowing for the continuity of their development until the end stage of life, to offer adaptation of health services, social services, integrated services for older person, so that they will respond to the needs of older persons and the aging populations, to provide access to long-term care, for those older persons that will need it is also a priority. We've also defined the enablers that are essential in order to guarantee the development of the decade. We have to be capable of hearing different opinions and to promote in a protagonic fashion the significant participation of older persons in the decisions they make. We need to strengthen leadership and the capacity in order to adopt appropriate measures, not only at a global and regional and national level, but also subnational and local in the different sectors. We need to put into contact the different interested parties by achieving inclusive information in terms of aging around all sectors of society and all the different professional levels of our human resources. And last but not least, we need to promote research and innovation in order to expedite the application and inclusion in policies. We invite you to participate in this process. The platform for the Decade of Healthy Aging is already available. In the case of our region, is already present in Spanish, in English, and in French, and we hope to have it in all the possible languages that are important for our region. Thank you very much. Patricia, back to you, over to you. Thank you very much, Dr. Vega, for that general overview of actions and the activities of the decade. Now let me give the floor to the representative of ECLAC, Mr. Sekini. Thank you, Patricia. Good morning, dear friends, colleagues from the United Nations system and the Inter-American system. Greetings to all from the Executive Secretary of ECLAC, Alicia Bárcena, whom I have the honor of representing today from this ELAC, the Population Division of ECLAC. We greet with great enthusiasm at this meeting the beginning of the launch of the Decade of Healthy Aging in the Americas that we're precisely celebrating during this International Day of Older Persons. As you know, aging is one of the main population phenomena in the world and in our continent. The increase in the proportion of older persons in society, as well as extending the life course that will continue in the long term, but unfortunately has undergone a significant backlash during the pandemic. And that entails a significant challenge for society and challenge in terms of public policies. And these challenges were the ones that promoted the adoption of the International Plan of Action of Madrid on aging. According to recent estimates and United Nations projections, this year, 2021, persons older than 60 add up to 88 million in Latin America and the Caribbean, people aged 60 years and older, representing 13.3% of the total population. And at the end of the Decade of Healthy Aging in 2030, the population, people aged 60 years and older, will increase in 30 million and will reach 118 million, 16.7% of the total population. And older persons, older than 80, will surpass the 18 million, representing 2.6% of the population. If we take a look at a longer term in 2050, it is believed that the age group of 60 and over will reach 190 million people and will represent 1/4 of the global population, 25% of the population. And people 80 and over that grows dynamically will almost triple that share and will reach 5.5% of the total population, thus reaching 41.5 million people, 60 and older. So aging undoubtedly is a matter of top priority and calls for urgent actions in several spheres, beginning by making it visible and also rethinking this from a point of view of human rights, gender, interculturality, in order to have a bearing on public policies. And it is within this context that we are getting ready for the fourth review and the 5-year assessment of the implementation of the International Plan of Action of Madrid that will take place at a global level in 2023 within the framework of the 61st session of the Social and Economic Commission of the United Nations, as well as getting ready for the regional review that will take place next year within the framework of the 5th meeting of the Regional Intergovernmental Conference on Aging and the Rights of Older Persons in Latin America and the Caribbean. Recently, from CELADE, we've begun this process through the presentation of a guide, the guide for the development of the country report on the implementation of the International Plan of Action of Madrid on Aging, and with the support of the United Nations Fund for Population, we're working with countries in the region. This fourth review and 5-year evaluation offers a very propitious opportunity to review the progress attained in recent years in the region on priority defined areas, persons of age and development, promoting health and well-being during the old age, and creation of environments that are propitious for health and development. And this, together with a decade of healthy aging, whose main objective is to improve the life of older persons, their families, and their communities. So the interinstitutional work and interagency work is a key, as it is today, in order to attain these results, as has been shown by the work done by the interinstitutional group of the United Nations on Aging. Also, this review will enable us to reach our progress in attaining regional agreements on this matter. We mentioned, for example, the Brasilia Declaration, the Charter of San Jose on the Rights of Older Persons 2012, the Montevideo Consensus on Population and Development 2013, the Inter-American Convention on the Protection of Human Rights of Older Persons 2015, and the Asunción Declaration of 2017. Thus, as at a global level, the 2030 Agenda for Sustainable Development. The information that the government provide through this guide will constitute the basis for the development of the regional report that ECLAC will present in regional and global entities during the fourth review and evaluation. Thus, how useful this tool is that we've prepared as a technical secretariat of the Regional Intergovernmental Conference. One of the main recommendations for the development of the country report is to ensure the participation, I repeat, to ensure the participation of the different government institutions involved in the policies of older persons, as well as representatives of civil society organizations in this population group. Thus, I would also like to stress the resolute role of civil society organizations of older persons, whose organizations and active participation is key in order to move forward with the promotion of their rights. We need to mention that within the context of the pandemic, at a global level, older persons are amongst the most impacted groups with greater vulnerability because of the direct impact that this has had on their quality of life, which has to be faced with the challenges that already existed in order to attain a full enjoyment of their rights. In a study that was recently published in the International Journal of Epidemiology, it is reported that in Chile, men 60 years old and older lost 1.2 years in life expectancy in 2019-2020, attributable to the death caused by COVID, and women in that same age group lost less than 1 year, 0.9.
Likewise, in Brazil, in accordance with an article published in British Journal of Medicine, life expectancy in 1920 is 1.3 reduction in the life expectancy. So the health crisis has shown us the need to strengthen national plans with very strong data collection systems data disaggregated by sex and age and gender. Because of all the points that we have discussed, we have to emphasize the protection of the older person in the center of our work. And then we have commitments that come out of many national and international instruments. We know that the governments of the region are making efforts in the control of the pandemic and also controlling the effects of all the health crises in the different social groups and the vulnerable groups. But if we want to recover what we had before, we have the moral obligation of facing this situation vis-a-vis the older person. Our eyes have to be centered in the universalization of health services, the strengthening of the legal framework for human rights, for the protection of the human rights of the elderly. So we are celebrating now the Day of Older Persons, and we have to make sure that all of these points are evidence that we give renewed importance to the life and the conditions of elderly populations. And just to make sure that they have a center and an important point within their families. So we have to have significant participation in this topic around the world. And I would like to thank PAHO for the organization of this event. We have a strong alliance with PAHO. And also we are centered, of course, in all the work of all the United Nations agencies. And we'd like to thank them for sharing their data on population. I wish all of you success to face all the challenges that this decade brings upon us. Thank you so much. Thank you so much, Mr. Sekini, for your participation and for calling our attention to the importance of the effects of the pandemic in the older person, and also to center on the fact that we have to have older persons as a priority during the decades, and that there are different types of aging and different opportunities for work. Now I will give the floor to Mrs. Mari Carmen Plata. Please go ahead. Thank you so much, Patricia. I would like to share my screen. Very well. From the General Secretariat of the OAS and on behalf of Mr. Luis Almagro, our Secretary General, it is a pleasure to be here with you in this important seminar. Our organization has had a long history of working together with PAHO, especially in the promotion and protection of the rights of older persons. Those colleagues who have already spoken have emphasized the importance of this topic in our region, as well as the implications that the decade has for all of us. As we have mentioned, the concept of adding life to years is very important at this point in time, because we are trying to manage the effects of the pandemic in our region. This has a different meaning for those who live in our hemisphere as compared to other areas of the world. Even though the quality of life and the length of life varies because of medical advances and individual conditions of the people, it is clear that we must focus in generating all the conditions that we're able to generate so that all persons can live with dignity and at the maximum well-being. Because we're talking about a population that is vulnerable in many senses. And at some point in time, we will be there. So the lesson learned is that many people in the Americas are living longer. At this point in time, they are not able to enjoy those lengthy years of life. So this is because of discrimination because of age. Also, many people feel marginalized and isolated. They have a loss, and they have actually lost their sense of wanting to live. So in addition to this, they have health problems, and this leads to more marginalizations, and this has mental and moral effects. Many of the members of the aging population are abandoned. And so there's a challenge in the protection of the rights of the older persons, especially if they are women, Afro descendants, indigenous populations, people with disability, refugees, displaced, people who do not have a country. And then these are victims of multiple discrimination, and considering the complexity of access to health care of all of these populations, in 2015, our Secretary General and our organization has the topic, more rights for more people. And so the cornerstone of our organization has been people and the citizenship in the Americas. In 2015, we started strengthening the concept of multilateralism centered in these populations, especially in the protection of human rights, safety, and the conditions of safety for all the peoples of the hemisphere. And this all covers the principles, the approach, and the action for healthy aging. In 2015, at the General Assembly of the OAS, we formed the Commission on the Protection of the Human Rights of Older Populations. And I want you to know about the importance of this convention. This Inter-American Convention on the Protection of Human Rights of Older People is the first legally binding document that ensures the recognition of the rights of the elderly, and then the freedoms, the essential freedoms that go with it. So we have inclusion, integration, and participation in society. This convention, among other things, has a legally binding text for our attitude again vis-a-vis the elderly. So this includes all the people from 60 to 65 years of age and older. And for that reason, the states should be able to recognize this concept. This concept also includes what we call the older adults, and it defines aging, discrimination by age, aging it by itself, active and healthy aging, among others. And I would like to stop here in active and healthy aging because it has some important concepts that I need to underline. For instance, the concept of aging that applies not only to individuals, but also to groups of population. And so all of public policies should be centered on that. The convention has as a general principle, the promotion of human rights and the freedoms of the elderly, the value of the elderly, the participation of the elderly in society, the autonomy of the elderly, because it is important to know that we should stay away of the concept of just assisting the population. We have to bring them into the action. We have to have their participation, their integration effectively in society. So we have other important aspects that we should mention about this convention that has 45 articles. Because of lack of time, I will not dwell on this. And they are available, and I invite you to just read this in details. The Secretary General of the OAS through the Inclusion Department in my secretariat continues to work with the member states to sign and ratify this instrument and to be able to work in their implementation so that we can generate more rights for more people and the direct contribution of our states. In 2017, this went into effect 30 days after Costa Rica signed the ratification document after Uruguay. And then whether you have adhered to this convention or you have ratified, we have Argentina, Bolivia, Brazil, Chile, Costa Rica, and Ecuador, El Salvador, Peru, and Uruguay who have ratified this. Peru was the last country to ratify the convention. And then with the adoption of the Inter-American Convention on the Protection of Human Rights, we had a landmark. We marked a landmark on the protection of the rights of the elderly. So we have all the member states and expert committees working on this. This is a wonderful opportunity for the active participation of the member states so they can share information in this general space of collaboration. And so for that reason, we underline the importance of the protection of human rights of all the populations of the America. In 2015, this was centered in a secretariat that works on the promotion of all the groups in situations of vulnerability, including the elderly. Our Department of Social Inclusion has the responsibility of forging ahead with the agenda for this protection within the framework of the convention. So in practice, this is just like a roadmap to work with the states in cooperation with them. And in 2020, we launched a practical guide for inclusive responses to COVID-19. And we wanted to frame this within the context of the elderly. And then we actually listed the importance of having resources so that the states could give assistance to the elderly and the older population. So also, just to make sure that we give guidelines and information to health teams and social assistance to the protection of human rights, and the states must guarantee the complete fulfillment of the rights and the respect for the rights of the older person, with emphasis on health and well-being. So in this sense, I would like to finish talking about a few concepts that perhaps we should work on together with our partners. First of all, we have a commitment. We will continue to promote the ratification of the Inter-American Convention on the Protection of the Human Rights of the Older Person and to educate about the content. We also want to offer a space for collaboration in support to the development and fostering of public policies together with the states, organizations, and international and regional agencies and specialized agencies. Also, we should promote spaces for exchanges, cooperation, construction of capacity and collaboration among the states to generate public policy focused on the elderly. And then finally, we have inclusion because we want to incorporate the civil society, as was mentioned, as key actors. It is not possible to have a roadmap for the health and well-being of the elderly if we don't take into consideration their needs and whatever problems they face right now. I would like to finish by thanking PAHO for allowing me to be here, for having this space right here. And then on our part, I want to ensure that we will continue to collaborate and to be committed in this effort. Thank you so much. Thank you so much, Mrs. Mari Carmen Plata, for your presentation and for talking about the Inter-American Convention and the commitment of the Organization of American States in the convention and other mechanisms related to healthy aging. Thank you so much. And now I will give you the floor to Mrs. Florbela Fernandez. Thank you so much, Patricia. Thank you so much for your invitation and special greetings to all the older person. Good morning to everybody. Before anything else, I would like to congratulate PAHO for their leadership in the launching of the Decade of Healthy Aging in the Americas. The framework of October 1st, the International Day of Older Person, with the topic of digital equity for all ages. The United Nations Population Funds joins this call so that the elderly have access and knowledge about the digital world. Along these lines, we celebrate and we support this opportunity for strengthening of joint cooperation and multi-sectoral cooperation to promote a lengthy and healthy life for all peoples. Inspired by the agreements of the Plan of Action of Madrid on ages and the Consensus of Montevideo and the 2030 Agenda for the Sustainable Development, we would like to join our efforts for a world in which the older person can be valuable, active, and productive members of society. To attain this effort and this goal, we need to have a shared vision. And we have to have this at the global, national, and local level, working in close alliance with representatives from the governments, the international organizations, the private sector, civil society organizations, and the older persons. The topic of aging is a very important part of our mandate. We have actually fulfilled an active role in the preparation for the Decade of Healthy Aging. And this includes, among other things, the participation in the development of the World Report on Aging published by WHO, and then a high-level event on the implications of COVID-19 for the older persons at the beginning of 2020. We have an essential commitment to close the gaps to access and availability of services, and we need more analysis on the impact of different models of care in the long term. And we have to have more data that show evidence of the needs of the older populations and the discrimination and violence they suffer, as well as innovations in technology are desirable for them to adopt. So we have insisted upon the fact that the increase in the number of older persons is not a problem. It is an achievement. And so what happens is that the societies have not prepared adequately for this announced demographic phenomena. In addition, aging, it doesn't mean exactly inequalities at the national and international levels. There are countries that are in an advanced area of aging, like Cuba, Uruguay, Chile, and Argentina. They have 1/5 of their population that is older than 60 years of age. They coexist with some countries in Central America, Guatemala, Honduras, Haiti, and Nicaragua, in which the process is under the average for the region. And then it has an initial phase at this point. The older person represents 13% of the population of the region. For 2050, it is projected that 1 of every 4 persons in our region will be 60 years of age or more. Women have a higher life expectancy than men. And for this reason, as the world ages, it will be a feminine world. And then this has important effects and consequences for policies and for actions in the area of health and in healthcare. In addition, women have less income, less savings, and they are the ones who are less capable to guarantee their own financial security at advanced ages. At the same time, the women are the ones who provide most care to the elderly. So we need urgently to correct these gender inequalities. Likewise, we need to tackle aging from a perspective of the life cycle that allows us to take action right now to ensure a favorable impact in the future. Last but not least, I would like to reiterate our commitment to work along with the International Plan of Madrid and the Decade of Healthy Aging, focusing on the promotion of advocacy and dialogue on policies for the adult population and the strengthening of the capacities, the collection of data, and innovation. Longevity is a triumph of development, and together we can build a world in which we can age with security, dignity, and based on the premise of inclusive rights, and so that no one is left behind. Thank you so much. Thank you so much, Mrs. Florbela Fernandez, for your presentation and concern about this movement, for reinforcing the importance of the interagency action regarding the rights of elderly populations and the human rights of elderly populations. Yesterday, we have a seminar about this topic in preparation for the launching of this decade. And now I will give the floor to Mr. Vinicius Carvalho Pinheiro from the International Labour Organization for his presentation. Thank you so much, Patricia, and thank you to all my colleagues and to the 159 participants who are connected. I believe that Simone has presented a fundamental topic. We are talking about a reduction of the life expectancy because of the pandemic. But it really, we has very, very striking figures, especially in the quality of life. We have followed, many people have followed what is going on with their parents, their elderly in the family. So we see an increase in the problems of mental health and isolation in some cases. And then those who are the survivors of the pandemics, we have seen that they have had the after effects of the pandemics in the quality of life and the years of life. And this is something that we have to manage. We have an agenda for this. We had an agenda before the pandemic, and now we have to have another approach after the pandemic. So we know that the region of Latin America and the Caribbean has been hardly attained by the pandemic. We see the indices of economic growth and the poverty percentages. So we see also populations in extreme poverty. We see many employment opportunities that have been destroyed because of the pandemic. And then, of course, we see a decrease in the employment of the population here. So since we started compiling this data within the pandemic and after we have been attained all this period with the pandemic, the pandemic has a disproportionate effect in our countries. So at ILO, we are looking at pre-existing conditions in terms of social factors, like the pre-existing social comorbidities as the effect of the pandemic. One of the things I must underline is the informal work. So we have seen a scenario in which 51% of the people now are working in informal jobs. And then we see also that the informal workers of today will be the informal workers of tomorrow. So this is a serious problem. And we, of course, have to have a vision to impose control measures for this type of phenomena. Sometimes in some of these informal sector jobs, we have minimum conditions of hygiene. So it is very difficult to try to handle the pandemic conditions within the informal work in the region. We have to determine how do we approach all of this population. Well, how do we finance isolation, in other words? So the informal work is one of the social comorbidities of the pandemic, not only in the elderly, but also in all other ages. And then, of course, we have the waves of contagion, and then we have to classify that by social strata. So inequality has affected all of this population in this context. And then we see that if we protect only those in the upper strata, what happens to the others? So we just postpone and postpone other solutions. So here I would refer to the gaps in social protection. People and countries that have already established gaps in social protection before the pandemic, well, they are able to protect them. But then how do we adapt these benefits, these social benefits within the pandemic scenario? We, in the past 20 years, have had an increasing level of social coverage with benefits. But then what happens with the pandemic? Now we have low coverage. And so we are actually facing a time bomb. But we have to increase the mechanisms for protection to the elderly. So all of these social comorbidities are there. They are in the heart of the measures to fight the pandemic. And then we have important data on that. We have had some collection of data on this for specific measures related to income, related to benefits, whether the population has health services or not. All of that is there, is on the table. And we, of course, have studied countries in Africa as well as countries here. But we see tremendous effects of the pandemic on coverage. So are we going to formulate policies? Yes, we can. Yes, sure. In some parts, we can. Of course, we have very, very poor countries where we say, how are we going to manage paying all of these benefits? We have a certain percentages of coverage for that population.
That is true. It's at the very heart, but to the extent that we cooperate, and it's an issue that deserves a solution. this cooperation and now framing everything within this framework, the first thing is that it is not sufficient, that this is not being translated into social gains. If we take a look at the figures, we see promising figures, percentages that go up on one and come down on others. And we all know that this is having an insignificant impact because it's a sector that doesn't use a lot of people, such as copper or livestock raising. These are sectors that have a low impact and multiplication of income, of revenues. And then in other countries, we do see that it is reflected in the GNP because of the isolation, but we're not creating jobs so that we can go back to the levels of 2019. In some countries, we already see the GDP levels going to 2019, and in others will go until 2023, 24, 25. And we have informal sector jobs. These are jobs that we see in the informal sector. And also ageism is unequal. Some are in the digital world with the competition that exists and the jobs in the future. So that is raising with the pandemic. So those who are behind are lagging more and more behind. And as the commissioner was saying, because of the impact of the pandemic, we had a hope with ECLAC, with Alicia, with these revenues that were integrated into the social system. These fringe benefits, in a way, could be articulated. So what is going on now with this? It is being affected because of the social impact, and that is reducing the level of benefits. So we see more informal sectors during the pandemic with an equal impact. We have not learned from the lessons of the past. And I speak for myself, and no doubt some of you have gone through this. You had the problem or the bad luck to be impacted by the virus, but we learned something. We have to be healthier so that this vulnerability will not affect us and have this great impact. And this affects our states and societies. What are we going to do so that we'll be better protected in the future? Include social revenues, the formal sector, reduce gaps, and create equal opportunities. And the fact is that we're not doing that well. Those are the initial statistics. It's the initial piece of information that we're getting during these quarters. It's a yellow light because ultimately it does have an impact on the well-being of the older persons and also those who will become older. So we have to dismantle this bomb, deactivate the bomb with a low coverage and accelerated aging, which will have an impact on the capacity to provide assistance to the older population. Thank you for your attention. So I leave these concerns with you. And obviously there are paths that we have to walk on. One is care. It is a highly important sector with the capacity to multiply jobs and revenues and income that employs migrants and young people. So it is an endpoint sector for many categories, and that has its place there in the future. So that's a very important. Another issue, which is a possibility of bringing in older persons into the economic activity, technology, that is also very well covered. So we do have opportunities, and we have to make the best of these opportunities and to overcome challenges. Thank you, everyone, for your attention. Thank you very much, Mr. Piñeiro, for your presentation and also for drawing our attention to the impact of the pandemic, and in particular, as related to these social comorbidities, as you mentioned, the informality, social inequalities, and the gaps in social protection, and even the point of care and economic protection of older persons. All of this is seen as very important for the achievements and the work that is to be done during this decade of healthy aging. So thank you very much. Thank you, everyone. Thank you to all our panelists, Dr. Vega, to Mr. Sekini, Ms. Mari Carmen Plata, Ms. Flobela Fernandez, and Mr. Vinicius Carvalho Piñeiro for your presentations and for the commitment on behalf of your agencies towards a healthy aging in the region. We're coming to the end of our seminar. And for the closing remarks of this session, I give the floor to Dr. Andres Francisco, Director of the Department of Family Health Promotion and Life Course of PAHO. Dr. De Francisco, please. Thank you very much, Patricia. Ladies, gentlemen, good afternoon. I'd like to say that I found this meeting as truly rich in information and content. Thank you very much to the participants for their points of view. Each one brought their own perspectives, and this is what is needed for the decade of healthy aging, that we have different points of view, and above all, that we have the same commitment towards a healthy aging in the Americas. I believe that this led us to a set of very interesting presentations. Unfortunately, we don't have the time in order to open up a discussion and talk about all these issues. But as someone said, this is one of many meetings that we will be holding in the future. Thank you very much to all the participants who were with us today and for the comments made on the chat that were also very interesting. The participation of different United Nations agencies and the Inter-American system in today's event simply bolsters the plan of action for the decade of healthy aging as an intersectoral strategy with the participation of different key stakeholders to add life to years. In beginning our efforts in order to implement the decade, we ought to do this in partnership with member states, international agencies, civil society, academia, the private sector. And we must be guided by older persons from all over the world, whose participation ought to be at the very core. The Director General of the World Health Organization has reiterated these issues in stating that in order to promote healthy aging, we have to work together. Older persons ought to occupy a central role and to be fully committed to this cooperation. The joint work with the different agencies in the region will favor and strengthen the development of activities around the decade of healthy aging in the region of the Americas, because older persons, and for older persons to have longer and healthier lives, and for the region to continue promoting strategies and actions for the promotion and the protection of older persons. As was pointed out by the Director General and the regional directors of WHO, in the recent launch of the platform for the exchange of knowledge of the decade of healthy aging, the cooperation amongst sectors, disciplines, regions, and languages is key for the success of this decade. In contact such as today, that must be repeated. Therefore, it is important that each and every one of us will be involved in the movement of the decade of healthy aging, connecting with other groups, sharing experiences and best practices, and hearing the older persons. The platform of the decade is the main mechanism for the exchange of knowledge and is available to all. We've sent the links over the chat. Today, this International Day of Older Persons, we celebrate the official beginning, the official launch of the decade of healthy aging in the Americas, and we sign this commitment of working together towards a healthy aging in the region. Thank you very much, everyone. Over to you, Patricia. Thank you very much, Dr. De Francisco. And before we bring the session to an end, I would simply wish to strengthen the importance of the platform of the decade. We received comments over the chat on how people can connect and participate in the decade, and therefore I invite you all to become acquainted with the platform and to register and to participate in the various actions of the decade. Last but not least, once again, we'd like to show the welcoming video of the decade, and with that, we will close the session. Fernando, please. Dicen que hay una edad correcta para todo. Nosotros creemos que la edad correcta es ahora.
Because you should have good health. Have dignity. be able to participate, have the chance to grow and develop, deserve to be happy. We believe that every year can be lived to the fullest because every year matters. Life has no age. We welcome the decade of healthy aging in the Americas. Join us and support healthy aging.
Muchas gracias a todos y feliz Día de las Personas
Thank you,
Mayores.
everyone, and a happy day, International Day of Older Persons.